You know that feeling of sheer panic when you accidentally delete a 20-page document you've been working on literally all day?
Yeah, the absolute worst. Heart drops into your stomach.
Exactly. And your hand just instinctively slams Ctrl-Z, right?
Right.
You hit undo, and in a fraction of a second, the whole disaster is just completely erased.
Like it never even happened.
Right. And I mean, we take that digital comfort totally for granted. Because in the physical world, in biology, we just don't get a Ctrl-Z. You break a bone, it takes months to heal, you get a terrible haircut, and, well, you're wearing hats for weeks.
Yeah, biological processes are they're bound by the slow, stubborn arrow of time. Healing requires synthesis, cellular replication, inflammation. It is a marathon, not a quick keystroke.
But what if I told you there actually is a biological undo button?
I'd say you have my full attention.
Well, it's a literal master key that you can inject into the human body to just temporarily melt away tissue barriers, instantly fix medical mistakes, or even, like, clear a path for life-saving drugs. Today, we are taking a deep dive into one truly fascinating enzyme. It's called hyaluronidase.
Ah, yes. In the cosmetic world, I think they just call it the magical filler dissolver.
They do. And we've got a massive stack of sources today. Medical journals, clinical protocols, pharmacology reviews, all centered on this one molecule.
And that reputation as a magical dissolver is, well, it's entirely earned, though it barely scratches the surface of what this molecule actually does.
Right, which is our mission today. We're going to unpack exactly how this enzyme acts as a master key for tissue permeability. We'll look at how it rescues botched cosmetic procedures and how it literally pulls patients back from severe vascular emergencies.
And we'll get into why its ability to dissolve our body's structural scaffolding is being used in everything from spinal surgeries to, surprisingly, cancer treatments.
It's wild stuff. So to understand how this undo button works, I think we first have to understand the wall that it's tearing down. The core molecule we're dealing with here is hyaluronic acid, or HA.
Right, HA.
What does this actually look like inside the body, like physically?
Well, if you visualize your connective tissues, so your skin, your cartilage, the whole extracellular matrix that holds your individual cells together, it is not a dry framework.
Okay.
It's actually filled with this thick, viscous, jelly-like substance that is hyaluronic acid. It's a vital glycosaminoglycan.
Wait, hold on. You're throwing glycosaminoglycan at me right out of the gate here. I have to admit I'm a little lost. In plain English, if we zoom in with a microscope, what does that actually mean?
Yeah, fair enough. That's a mouthful. Think of the cells and the structural proteins in your body as the bricks of a house.
Okay, bricks, got it.
Hyaluronic acid is the wet mortar between those bricks. It provides structural integrity, it holds moisture, and it acts as this incredible shock absorber.
So it's basically the biological glue holding the neighborhood together?
Exactly. And chemically, it is just a massive repeating chain made of two specific sugars, an acetylglucosamine and glucuronic acid.
Just two sugars repeated over and over.
Yep, repeated over and over. And those two sugars are locked together by a chemical bridge called a beta-1,4-glycosidic bond.
Okay, that sounds intense.
It is. That bond is incredibly robust, which is what makes hyaluronic acid highly resilient to physical stress. And this is exactly where our enzyme hyaluronidase enters the picture.
It's the wrecker of that specific bridge.
Precisely. It is an endoglycosidase. Its singular evolutionary purpose is to hunt down those specific beta-1,4-glycosidic bonds and hydrolyze them.
Hydrolyze meaning it uses water to break the bridge.
You got it. It forces a water molecule directly into that chemical lock, snapping the massive HA chain into tiny, totally harmless fragments.
Okay, I have an analogy for this. Tell me if I'm on the right track.
Let's hear it.
Imagine you're playing with Legos. The hyaluronic acid is this tightly locked, massive wall of Lego bricks. You could try to pry it apart by hand, which is exhausting, takes forever.
Right. Terrible for your fingernails.
Exactly. But hyaluronidase is that specialized little orange plastic tool that comes in the big Lego sets. You wedge it in, and it just instantly pries those stubbornly locked pieces apart.
That is a brilliant way to picture it. It turns a solid wall back into a pile of loose pieces in seconds. By breaking those bonds, the enzyme rapidly drops the viscosity of the extracellular matrix.
So it goes from a thick jelly to, like, a liquid.
Basically, yeah. It takes a thick barrier and turns it into a highly permeable liquid state. And the crazy thing is we actually naturally produce variations of this orange Lego tool
Oh,
ourselves.
really? We make this stuff.
We do. Humans possess 6 different genes that code for hyaluronidase, hyalurl 1 through 4, LELPO, and PH20.
Wait, 6 different genes just to break down this one type of biological mortar?
Yeah.
It seems like a bit of overkill, doesn't it?
You'd think so, but regulating the thickness of that mortar is actually a matter of life and death for cellular function.
How so?
Well, say a white blood cell needs to travel through tissue to fight an infection. The tissue cannot be a solid brick wall. The body needs to constantly break down and rebuild this matrix for cell migration and tissue repair.
Oh, that makes sense. It needs to clear a path.
Right. HYL1 does the heavy lifting for degrading the extracellular matrix on a day-to-day basis. But when we synthesize this enzyme in a lab, concentrate it and use it as a medical tool, the effects become incredibly dramatic.
Which brings us perfectly to the massive boom in aesthetic dermatology.
Yes, the lip fillers and cheek fillers.
Right. Dermal fillers are everywhere now. People are injecting them to build up their lips, jawlines, whatever. And most of those fillers, from what I read in the sources, are just highly concentrated synthetic hyaluronic acid.
That's right. Injectors are essentially adding artificial mortar to build up volume under the skin.
But the problem arises when the procedure, goes wrong. An injector might misjudge the volume, and suddenly you have a lopsided lip.
Or the filler migrates over time, causing this strange wandering puffiness.
Ugh, yeah. I read about the Tyndall effect, too, where filler injected too close to the surface of thin skin creates this weird, unnatural bluish tint.
Yeah, that happens because the gel physically scatters the light hitting the face.
So before we had this concentrated enzyme as a standard tool, what did people do?
Honestly, you just had to wait out the clock, sometimes for over a year, just waiting for your body's natural enzymes to slowly degrade that mistake.
That is brutal. But now, clinics use hyaluronidase as an elective cosmetic reversal. They just inject a tiny amount of the enzyme directly into the lopsided bump.
Exactly. Because the chemical bridge is identical, the enzyme cleaves the synthetic HA just like it would native HA, and the mistake dissolves almost instantly. It is a massive safety net for the aesthetic industry.
But I mean, fixing a lopsided lip is kind of a luxury, right?
It is. The true value of hyaluronidase really emerges when we look at the catastrophic risks of these procedures.
Yeah, the vascular emergency. Let's get into this because this part of the deep dive totally stressed me out.
It is intense. The human face is this highly complex, interconnected web of blood vessels. When someone is placing filler, there is a very rare but very real risk that the needle accidentally punctures an artery.
And they deposit that thick, viscous HA gel directly into the bloodstream.
Yes. They are essentially injecting a gel plug right into a blood vessel. The flow of blood just hits a brick wall.
That is terrifying.
It's an immediate roadblock. The tissue downstream from that blockage is suddenly starved of oxygen. And this ischemic event sets off a terrifying chain reaction.
The sources mention the skin blanching, like turning stark white as the blood leaves the tissue.
Exactly, that's the first sign. It's followed by severe pain and this live dough pattern, which looks like a purplish web-like modeling on the skin.
And if they don't fix it fast.
If blood flow is not restored rapidly, the tissue begins to die. That's necrosis.
And it gets even worse depending on the artery, right? Like around the nose or forehead.
Yes, because the blockage can travel backwards through the vascular network and occlude the central retinal artery. The patient could permanently lose their vision in a matter of minutes.
Oh my gosh. So when an injector sees that skin turn white, they have to abandon the cosmetic stuff instantly and trigger what the protocols call the flooding protocol.
Right. And the flooding protocol requires a massive, immediate intervention. Current clinical guidelines dictate reconstituting an enormous dose of the enzyme. We're talking frequently 1,500 international units of hyaluronidase mixed into 10 milliliters of saline.
10 milliliters. That is a huge volume of liquid to just blast into someone's face all at once.
It is. They take this massive syringe and literally flood the entire ischemic field, injecting everywhere around, along, and just beyond the blocked vessel.
Just bombarding the area. And they repeat this, right, every 30 to 60 minutes until sustained blood flow returns.
Exactly. They are relying on the enzyme's core function, modifying tissue permeability. They create a localized pool of the enzyme, allowing it to diffuse through the vessel walls from the outside, degrading the HA plug until the blood pressure can blow through the weakened barrier.
Something I realized from the journals is how wildly the diffusion behavior of this enzyme changes depending on what kind of tissue it's moving through.
Oh, absolutely. Tissue density plays a huge role in an emergency reversal.
Right. Because I was reading about how it diffuses in superficial mucosal tissue, like in the lips.
Yeah.
It's highly permeable, so the enzyme spreads super fast there.
Yes, mucosal tissue is very forgiving in that way. It acts almost like a sponge.
But then compare that to trying to reverse something deep in dense fibrous tissue.
Yeah.
Like, think about Halban's fascia down in the female reproductive system. Obviously not a facial filler area, but just as a comparison of tissue density.
That's a great comparison. Halban's fascia is incredibly dense connective tissue.
Right. If you were trying to diffuse an enzyme through something as thick as Halban's fascia, it would behave completely differently than in superficial mucosal tissue, right? It would struggle to spread.
Absolutely. Dense collagen networks act like a physical barricade. The enzyme has to work so much harder to diffuse, meaning you might need higher volumes or more frequent dosing compared to a mucosal layer. The physical density of the tissue totally dictates how well the undo button works.
That makes total sense. But wait, I have a critical question. If I'm a patient in this nightmare vascular occlusion scenario, and my injector used a non-HA filler, like Radiesse, which is calcium hydroxylapatite, or Sculptra, does this flooding protocol melt those too? Because calcium hydroxylapatite is essentially liquid bone.
Yeah, unfortunately, the structural chemistry is entirely different, so the enzyme is completely useless against the plug itself.
Wait, really? It won't touch it?
Not at all. Hyaluronidase strictly, biologically, targets only those beta-1-4 glycosidic bonds found in hyaluronic acid. It will not degrade liquid bone. It will not degrade liquid stitches.
So if an injector blocks a vessel with Radiesse, they can't dissolve the blockage. What happens? Do they just watch the tissue die?
Well, they don't just give up. You might have noticed some clinical literature mentions using hyaluronidase off-label in these non-HA emergencies.
Yeah, I saw that and was confused. Why inject it if it can't touch the plug?
It comes down to collateral effects and pressure mechanics. Even though the enzyme cannot dissolve the calcium plug, flooding the area with hyaluronidase will still rapidly degrade the patient's native hyaluronic acid in the surrounding healthy tissue.
Oh, it melts the mortar around the blood vessel.
Exactly that. By stripping away the structural gel in the surrounding tissue, you dramatically reduce the interstitial pressure pressing in on the blocked vessel.
So the swelling drops.
Right. By removing the pressure from the outside, the hope is that the vessel dilates just enough to allow a tiny bit of blood flow to squeeze past the blockage on the inside. It's a desperate secondary measure.
But hold on. If we are injecting a chemical that indiscriminately melts the native mortar in the surrounding tissue, why doesn't the patient's face just collapse into a puddle?
It's a valid concern.
It sounds like using a powerful stain remover on a shirt, but the chemical is simultaneously eating a hole in the cotton itself.
That's a very accurate analogy. Indiscriminate use absolutely causes unintended collateral damage. The enzyme is highly specialized, but it's blind.
Right. It doesn't know what's artificial and what's natural.
Exactly. It cannot distinguish between the synthetic filler injected yesterday and the native HA your body spent weeks building. If an injector uses too much, they strip the natural support out of the patient's extracellular matrix.
Which does what?
It unmasks underlying aging changes. The patient will experience acute volume loss, uneven skin texture, severe skin laxity. The area can look completely hollowed out and deflated.
Yikes. Trading a lopsided lip for premature aging.
But, and this is a big but, it is highly temporary. This really highlights the incredible resilience of the human biological machine.
Do they bounce back?
Very fast. Once the enzyme degrades the native HA, the dermal fibroblasts, those are the cellular factories that build the matrix, they immediately recognize the deficit. They go into absolute overdrive, synthesizing fresh hyaluronic acid.
Wow. How fast are we talking?
The tissue typically restores its natural HA baseline in about 15 to 20 hours.
That rebound speed is staggering. Less than a day.
It really is. But even with that quick recovery, dosing this enzyme is a high-wire act. You can't just guess.
Yeah, the sources had all this math. For elective reversals, practitioners average about 35 units of the enzyme for every 0.1 milliliters of known filler.
But the math gets complicated because not all HA fillers are created equal. This has led to a fascinating arms race in filler engineering.
Yes, this part was super interesting. Manufacturers are constantly tweaking the chemistry of their products to make them last longer under the skin, right?
Right. And that engineering directly dictates how successfully the hyaluronidase can actually penetrate and do its job. We see a massive difference when comparing highly cross-linked fillers to biphasic fillers.
Okay, let's break that down. Highly cross-linked fillers first, like the VYC RSS range. The manufacturers use chemical bonds to cross-link the HA chains tightly together, giving the filler a very high elastic modulus, or G'.
Think of cross-linking like weaving a net. The more connections you make between the ropes, the denser and more rigid the net becomes. These monophasic gels act like reinforced concrete.
So the enzyme just bounces off.
Basically, because the structure is so tightly woven and chemically reinforced, the hyaluronidase enzyme physically struggles to penetrate the surface layer. It has to chip away at the block from the outside in.
So those require multiple high-dose enzyme sessions to fully dissolve.
Exactly. But then there is a mechanical exception here that is just brilliant: biphasic fillers, like the ones utilizing Nasha technology.
Right, and these actually boast some of the highest G', the highest firmness on the market.
Yes. So, by all logic, the firmest filler should be the hardest to dissolve, right?
Right, but they dissolve rapidly and uniformly. Why is that?
It's due to a structural vulnerability. Biphasic means instead of being a single, smooth, continuous block of dense gel, the filler is composed of distinct, ultra-firm particles of HA suspended in a much lighter carrier fluid.
Ooh, like a jar of tightly packed marbles and syrup.
I love that analogy, yes. Marbles and syrup. And because of that particular structure, there are microscopic gaps between the marbles.
The enzyme slips right through the syrup.
Yes. When you inject hyaluronidase into a biphasic filler, the enzyme surrounds every individual particle at once. It exponentially increases the surface area the enzyme can attack simultaneously.
Oh, that is so cool. The structure itself provides the vulnerability. Okay, so we spent a lot of time on how this enzyme rescues faces and stops necrosis, but if this is just a biological tool for safely melting mortar to let fluid flow, it has to be useful far beyond a dermatologist's chair.
Oh, absolutely. The aesthetic applications are just a fraction of the story. When we view hyaluronidase as a tool to solve complex mechanical blockages deep inside the body, the medical applications become extraordinary.
Right, like in spinal interventions. I read about failed back surgery syndrome, or FBSS.
Yes. When patients undergo back surgery, the body's natural inflammatory healing process often goes rogue, creating these dense epidural scars.
Which are fibrotic adhesions that wrap around the spinal canal. It's like pouring thick glue directly over delicate nerve roots.
Exactly. And these patients live in chronic, severe pain. When pain specialists attempt to inject localized anesthetics or steroids into the spine to calm those nerves, the medication just bounces off the dense scar tissue.
The drugs physically cannot reach the trapped nerves because the matrix of the scar is too thick.
Right. So they utilize a procedure called adhesiolysis. They mix our biological undo button with the anesthetic.
And it melts the glue.
Literally. The hyaluronidase goes in and rapidly hydrolyzes the proteoglycan matrix of those epidural adhesions. By breaking down the HA within the scar tissue, it opens up microscopic channels, allowing the pain-relieving steroids to finally bathe the trapped nerves.
And this study showed this actually works.
Amazingly well. Patients who receive the enzyme alongside the anesthetic achieve sustained relief and improved range of motion that vastly outlasts patients who receive the anesthetic alone.
It just completely clears the path. We saw this exact same principle in ophthalmology, too.
Yes, parabulbar blocks.
Right. Eye surgeons need to inject anesthetic around the back of the eye before surgery to induce akinesia, basically stopping the eye from moving. And if they add hyaluronidase to the syringe, it melts the connective tissue barriers behind the eye.
And the anesthetic spreads instantly. The eye stops moving much faster, allowing the surgeon to get to work safely.
It fundamentally alters the permeability of the local environment, which led orthopedic researchers to do some really fascinating studies involving rabbit knees.
Ah, yes, the hydraulic resistance studies.
Right, they were trying to figure out what creates the hydraulic resistance in the synovial lining of joints. Like, why doesn't the lubricating fluid inside your knee joint just leak out into your leg muscles?
So they infused these rabbit knees with different types of hyaluronidase to see what would happen.
And the types they used were wild. Some enzymes were derived from bovine tests, some from Streptomyces bacteria, and remarkably, some were derived from leeches.
Wait, leeches?
Yes, leeches, and it highlights the evolutionary importance of this enzyme. Nature is incredibly efficient. Why would a leech or a pathogenic bacterium evolve to produce an enzyme that melts human connective tissue?
Ah, well, for a leech, it is a biological weapon.
Exactly. A leech needs to feed efficiently. If it just bites you, your tissue swells and restricts blood flow. But if the leech injects hyaluronidase, it melts the tissue barriers around the bite,
keeping the tissue highly permeable. It acts as a spreading factor, allowing the leech's natural anticoagulants to push deeper into the host, keeping the blood flowing freely into its mouth.
It's disgusting, but brilliant. And bacteria use it for the same reason, right?
Yeah.
Invasion.
Yep. Streptomyces bacteria secrete hyaluronidase to break down the host's extracellular matrix, turning a solid barrier into a liquid highway, allowing the infection to spread rapidly through the tissue.
So when the researchers injected these highly specific bacterial and leach enzymes into the rabbit joints, what happened?
The hydraulic resistance dropped to near zero. The joint fluid simply washed out into the surrounding tissue. It definitively proved that interstitial hyaluronic acid is the primary physical barrier keeping our joint cavities pressurized and lubricated.
And once you melt the HA, the pressure system just collapses.
Precisely. And this ability to manipulate pressure and permeability is now crossing over into the absolute cutting edge of medicine, oncology, and nanomedicine.
This was the part that truly blew my mind. Researchers are using hyaluronidase to solve the hardest problem in cancer treatment, getting the drug into the tumor without killing the healthy tissue along the way.
Yes, the targeted delivery problem.
You look at the research on antimicrobial silver nanoparticles, they literally build a microscopic delivery system, like a little cage, out of hyaluronic acid.
And they trap the silver nanoparticles inside this HA cage.
Right. And they can flood the body with these cages, and they remain completely inert.
Because the drug is trapped, rendering it harmless to healthy tissue. But when these cages accumulate around a tumor, or say, a severe staph infection, doctors can inject targeted hyaluronidase directly into the site.
The enzyme acts as the key, melting the trapdoors of the HA cage and flooding the specific target with the antimicrobial silver exactly when and where they want to.
It's incredible. It turns the extracellular matrix from a stubborn obstacle into a programmable therapeutic tool.
It really does. But, there is a critical missing piece to this puzzle that I kept wondering about while reading.
What's that?
If we are injecting a chemical key that rapidly mints the structural glue of the human body, why doesn't it just keep going?
Ah, right.
Like, why doesn't a single injection of hyaluronidase cause a runaway chain reaction that just dissolves the patient's entire body?
That is a very comforting answer, actually. It lies in the enzyme's incredibly aggressive pharmacokinetic clearance rate. Its half-life in the human serum is approximately 2.1 minutes.
2.1 minutes. That's nothing. It is gone almost as soon as the needle leaves the skin.
Exactly. It is the ultimate hit-and-run molecule. From an evolutionary standpoint, the body simply cannot tolerate a rogue tissue melter roam in the bloodstream.
Right. A runaway degradation cascade would be biologically catastrophic.
Widespread vascular collapse. So the liver and kidneys are highly optimized to recognize this enzyme and scrub it from the system instantly.
So it does its job, cleaving the local bonds and opening the tissue, and then it just vanishes.
The effect, the localized permeability, lasts for 24 to 48 hours until the dermal fibroblasts rebuild the HA mortar, but the enzyme itself is neutralized in minutes.
Wow. It is a profound mechanism. We tend to view human anatomy as a series of fixed, static structures: bones, ligaments, tissues.
But hyaluronidase proves that our tissues are highly dynamic. With the correct biochemical key, we can temporarily unlock them, radically alter their physical state, and then allow them to safely reconstruct themselves.
That perfectly summarizes the journey we've taken today. We've traced an enzyme that literally edits the physical architecture of your biology. It's the emergency floodwaters that restore oxygen to dying facial tissue.
It is the microscopic machete clearing a path through spinal scars.
And it is the precise key unlocking nanoscale drug cages. But, as we master these tissue permeability modifiers, it leaves us with a mind-bending idea to ponder for the future.
Let's hear it.
Right now, we use this orange Lego tool to temporarily melt highly localized specific barriers. But what happens when we map the entire structural matrix of the human body?
Oh, wow.
Imagine a near future where we can selectively turn any solid tissue, a hardened, inaccessible tumor, a dangerously calcified artery, a heavily scarred heart, into a porous, sponge-like superhighway for nanobots or targeted genetic therapies.
We deliver the payload and then simply let the body rebuild the wall behind it.
Exactly. If we can master this biological undo button, what other keystrokes are hiding in our DNA waiting to be pressed? That's something for you to mull over until our next deep dive.